Okay.
All right. Well, thank you all for joining. Um, we'll try to make it pretty quick. Um, Obviously, if you got any new business or any thoughts at the end, we can add it to the agenda. But kind of things we are talking about going over was the Just Walk update, then the billing subgroup update, and Dave can give an update on that. Katie will give an update on the Just Walk, and then the curriculum group. I can give an update. Um, and we had our last meeting of that back in November. So, um, yeah, Katie, if you just want to go ahead and give everybody a quick rundown of the Just Walk meeting, that'd be perfect.
Yeah, absolutely. So just as a reminder, the Just Walk subgroup meets once a month on Tuesdays for about 30 minutes. So our next meeting is actually January 9th, and it's from 8:15 to 8:45 if you're interested in attending. As a reminder, we are not going to resume Chris Harris Park until we have interest from the community. So I think our last Just Walk meeting or our last healthcare meeting, I mentioned that I'll be attending the Ivanhoe Neighborhood Council or Association meeting. Um, and I said I would do that in January. I'm rescheduling that to February. So I'll meet with them and get their input. I'll be distributing a survey to see if they're interested in actually resuming walks at Harris Park or if they would like to switch it to a different location in the Ivanhoe neighborhood area. And then our other walk location is Mill Creek Streamway Park. So our upcoming walk is actually the sorry, it's a new year. I don't know my Saturdays. It's the 13th. So that'll actually be held indoors at Mill Creek Activity Center. So we do have a healthcare lead. So Kelly Dunlap was kind enough to volunteer for that. We are still looking for a general volunteer. And on that note, we are going to see how this walk goes. Um, and if we don't have any participants, I believe the plan is to kind of hold off for a while and kind of reconvene to see how we can increase participation. I know that Allison Smith, she's our Parks and Rec co-lead, submitted an application. Um, pardon me. We have a waiting room if everyone didn't notice, and I need to message somebody, so I'll try and multitask on this. Submitted an application for an implementation proposal requesting funding to resume that Just Walk location for this year, as well as she asked for money for incentives. So we'll see if that passes, and if so, maybe that'll be something we use to help increase participation. I believe that is it. I apologize. Okay, Jay.
Yeah, on that, I was just wondering, did we end up seeing if KU, UMKC, if we could all three kind of partner and make more of a group deal about it so we could have just more resources and people to pull from?
Yeah, so I'm still waiting to hear back from KU. And as for UMKC, um Stephanie Ellison, she's great. We didn't talk about doing it at the same location, but rather she's going to see if any of her students would be willing to help us out.
Cool. All right. Anybody got any questions on the Just Walk part?
Have anything to add to that from UMKC? I know Stephanie Allison's your primary contact there, and she usually lets me know kind of what's going on. I'm closer uh, most of the time to the PA program, so if there's anything kind of more PA student specific, let me know. Otherwise,
Yeah,
I'll kind of wait to hear from Stephanie on that.
as far as the PA stuff goes, I think, well, and I don't know what all the specifics are about Children's Mercy employees and other employees coming, but yeah, we named it Just Walk specifically so that we could have PAs, nurse practitioners, athletic trainers, physical therapists, whoever in the healthcare, pharmacist, could join and give a little talk and be involved in it. So it didn't just have to be physicians all the time.
Sure.
So yeah, if any of the PAs want to be involved, we'd be more than happy to have them join.
Great.
All right. Dave, you want to go on with the billing subgroup? I know it's been somewhat on pause, but go ahead.
Yeah, so thanks. Billing, to give us a lot of background, just to take you to where we are. We met a lot a while back to figure out how we can do billing and reimbursement for exercise and physical activity. What's the word I'm trying to look for? Counseling in clinical settings. And we've ran into a lot of roadblocks. It doesn't seem like there's really a lot of methods to do this right now, especially if you're an exercise physiologist or not a physician or nurse practitioner, physician assistant, whatever. There's really no means for exercise physiologists to bill for any sort of exercise counseling. Physicians and other qualified healthcare professionals can, but we couldn't, the jury was still out and we couldn't really figure out how those codes would interact. If you're seeing them for something else and you do some counseling with them, how those codes will interact with other codes. So that's something we've ran into a lot, and that kind of halted us from going down that rabbit hole much further. I've gotten pretty involved in an organization through American College of Sports Medicine called CEPA, Clinical Exercise Physiology Association, and they're really championing the billing and reimbursement for exercise counseling on a national level. And I've met with their leader a few times to talk about these kind of things, and it seems like we're a ways off from anything in that realm, which kind of stinks. One of the pathways then we started to explore more, and we're kind of still going down this rabbit hole, is using the remote patient monitoring codes, which are not necessarily specific for physical activity and exercise, but can be, we think, can be leveraged in that way. So we're going kind of down that way, and we're looking at developing some sort of an app-based way that we could see patients in clinic and give them an exercise prescription, and use an app through we're trying this through Children's Mercy's MyCare app, to see if we can give them exercise prescription and maybe utilize the remote patient monitoring codes to do that. There's a company called Workout Labs, and they have an app for exercise prescription, and it was built specifically for like personal trainers and stuff to give their clients exercise prescription, but it has been picked up by Cincinnati Children's, Cook Children's, I think Lurie Children's, and Phoenix Children's to be used for exercise counseling and prescription. And they make a white label version where it would be like Children's Mercy's logo, but when you click into it, it goes into the Workout Labs like guts. And we are kind of playing a little bit of phone tag to get a meeting with them to get a demo from them. So it's kind of veered away from the billing thing into this app-based exercise prescription thing, kind of in the way back of our heads, thinking that we could use this app to use remote patient monitoring codes to get reimbursement for this. But we're messing with this. There's a lot of people up in Detroit doing a lot of work in this realm, and stuff like that. So we're not by ourselves, but
Yes,
it's a hard one.
I know on that remote patient monitoring part, that's something we've been looking at through the sports medicine world, and people have definitely been doing that in sports medicine with giving a home exercise program from the athletic trainer at the end of a clinic visit, and then checking in with them and being able to put that on that kind of remote monitoring. You can check on whatever app you use, whatever service you use, and you can see how often people are logging in and checking on it and doing the things.
Are you billing
Um,
for that at all?
So Children's Mercy is not exactly on board for us billing for that.
Yeah, yeah.
But I know people have been doing it because they talked about it at our last sports medicine meeting in Phoenix. There was a whole hour-long session early morning, kind of outside of the normal curriculum of the conference, where people were talking about it, and they're definitely doing it at some other hospitals,
Yeah.
but Children's Mercy is usually pretty conservative about that kind of stuff. I don't know, maybe UMKC wouldn't be as conservative about some of those things, but anything new takes a long time at Children's, as you know. So
Yeah. The billing code, that's something that we've gone down quite a big rabbit hole with too, is and you can cut me off if I get too long-winded into this. The billing codes, the way I read them, are very kind of clear and straightforward. You have to, but one of the things that they require is a device to collect physiologic data. Physiologic data is collected electronically, transmitted electronically, and stored electronically. That's a big requirement for any of these codes to work. But the code itself says it does not, the physiologic data does not have to be collected using an FDA approved medical device, but a medical device that meets a device that meets the definition of what the FDA would call a medical device. So it's not like it doesn't have to be approved, it just has to meet the definition. So
step counter.
right, an accelerometer, right, a Fitbit, one of those kind of things. I don't know if steps count as physiologic data, but heart rate does,
Okay.
right? So if you give them a Fitbit that has heart rate, you collect heart rate, you transmit heart rate, and that meets the code requirements. But when you do that through the API, through the Fitbit or whatever device, you also get movement, activity minutes, you also get patterns, you also get steps, you also get all that stuff, sedentary time, whatever. But as you just said, Children's Mercy's definition of a medical device is different than what the code says. They're a little bit more conservative in that way. The other thing that we thought was an advantage of the remote patient monitoring codes is the counseling aspect of it can be delivered by a qualified healthcare professional, a physician, or what they say is clinic staff. And clinic staff is typically a occupation that is not able to bill independently like a nurse, but it can still represent the time that they take to do that. And the reason why we went down this way is because we thought exercise physiologists would meet that criteria. However, another Children's Mercy thing, which I would be really curious about, see how other institutions interpret this. And I challenged them a lot on this, and they never really gave me an answer, is how they define what clinical staff is. Because they define clinical staff as a physician or qualified healthcare professional, to which I went back to them and said, well, why would the codes call it 3 different names if the 3 different names didn't represent 3 different types of people? So what does Children's Mercy define as that type of person? Because why would they add that name in there, right, into the code? To which let's go check with some people, and then it just disappeared, and I never got an answer. Yeah. That's happened a couple times. So
that we've had that same problem specifically with our athletic trainers. At other institutions, athletic trainers are allowed to do a lot more in their scope within the hospital. Their training, their master's level training allows them to do a lot of things in a clinic setting that Children's Mercy does not technically allow them to do or to be reimbursed for, things like that. So it is very institutionally dependent, I would say, from what it sounded like, because there are people out there who are using their athletic trainers to do all that kind of stuff, being the qualified healthcare professional who is delivering that care and that information. And I would think an exercise physiologist, a physical therapist, any of those people would clearly fall into that category as well. So I would think nursing too. Just depends on what you've been educated on how to do it. So yeah, I think it'd be interesting maybe to see if one of the other institutions in our group could make it work, being a little less, conservative about some of those approaches. I
Or
don't
at
know.
least we could talk to one of their billing people to see how they define, how these different institutions define these different roles and how they interpret their remote patient monitoring.
And then
Yeah. I
Ed,
see that.
looks like you got a thought on that. And John, both of you, I see in the chat.
Yeah, Ed, I'll send you an email. I loved I'm kind of in a silo here, seeing how Children's Mercy does things, but I would love to see how others do it. Yeah.
Well, that sounds good. Yeah, Dr. David Varan, a fellow family physician, he's doing a better job of almost retiring than I am, but he's very reachable by email. Very tech savvy. He used to work for Cerner once upon a time. I've connected him with, I think, this group or maybe the larger lifestyle group before, or at least attempted it. So anyway, he also he's done some studies actually on wearable devices, and I imagine part of that had to do with coding and billing. Probably more from the physician's perspective at University Health.
Mhm.
But I know that he would be very much aware that there are other people besides, docs and PAs and nurse practitioners who provide counseling service in various areas, including active living and exercise prescriptions, that kind of stuff. So anyway, he'd be a good resource.
Yeah. Yeah. Thank you for that. I'll shoot you an email. Thanks, Katie,
Great.
for giving me the email in the chat. One thing that I've struggled with a lot, and this is me coming into billing and coding, not knowing anything about billing and coding, is how things are defined. What is the definition of X, Y, and Z? What is the definition of this, this, and this? And how the interpretation of those definitions is so variable. But I think it's not unreasonable to leverage those definitions to encompass physical activity and exercise counseling and data collection. But that's me reading the things and interpreting them myself versus somebody who does this and says, oh, the definition means this, but this is what it actually means. I don't know what that is. So yeah. But thank you. I appreciate that. Otherwise, Jay, I don't have much else.
And I've been trying to get David Varan's email. I've got his UMKC email, which I think would probably work as well as anything, and I'll put that in the chat now. If I come up with his University Health email, I'll put that in there too. If you want to contact him directly, that's fine, and or send it via me, and we'll get you guys connected.
Okay.
And then I was bad about looking at the chat earlier. Joan, was your comment on the billing part or on the just walk part? Because I saw you said the Rockhurst OT students might be interested in helping, but then I thought maybe that was for a while back on the just walk.
I believe it was just walk because she posted that while we were discussing that, so.
Oh yeah, I guess I could have looked at the time on there. Yeah, good call. Thank you. Okay, and then the last part is the curriculum subgroup. We met back in November, and we had Shannon. Oh shoot, what was her last name? Holmes. Sorry, Shannon Holmes. Come and talk to us directly from the ACLM, American College of Lifestyle Medicine. She's kind of their curriculum expert, and she had a great talk with us, a good 30, 45 minutes. And Katie did a really good job of summarizing it. And we can always send that back out if anybody wants to see the full summary, because it's really in depth and a great job. But just kind of went over some of the stuff we learned from Dr. Trilk, and then some extra stuff beyond just what's happening at the University of South Carolina. But she kind of reiterated that we got the food, the 6 pillars, the whole food nutrition, plant-based nutrition, being 1, regular physical activity, being 2, restorative sleep, being 3, avoiding of substance abuse, risky substance behaviors, number 4, number 5, positive social connection, and number 6, stress management. And just again, how they're trying to help incorporate and show medical schools how to incorporate these pillars into their curriculum, and giving some real resources for that. But they also have some good resources for even teens, so kind of high school stuff, college level stuff, other healthcare professionals beyond just the medical schools, some residency resources, so postgraduate training, and then some certification things. And I thought one of the cool things they're working on is trying to give out different levels of certification to some medical schools, where there's a bronze, silver, gold, and platinum. I think there were 4 levels, if I remember. It's basically if you can incorporate 25% of the competencies, you get a bronze level, 50% silver level, 75 gold level, and 100% platinum level. And there were some applications or some scholarships for application for the ACLM to review the curriculum for the schools. I think that ended in December, although if they didn't finish all those scholarships, there might still be some out there. But there's also some money from the ACLM about helping with the medical school interest groups. So lifestyle medicine interest groups, and some scholarship money to help establish some of those. There's some question banks that can help schools kind of utilize it for sort of a step 1 questionnaire and things like that, because there are some things, some ways to incorporate some step 1 learning, step 2 learning into those lifestyle medicine curriculums, which I think is probably the biggest thing for most of the medical schools, is making sure they're not wasting curriculum time on things that aren't going to be on a test. It seems to be sort of the biggest barrier, I think, probably most of the schools. If they can prove that the lifestyle medicine stuff is valuable for testing and getting people to graduate and have good step scores, then they're going to be more likely to use it. So it's a really it's pretty comprehensive website, a lot of resources on there. So I think for our partner schools, and again, any allied health professional stuff, we can get them using that. But if we got any champions at the high school level, any district wide sort of teachers who deal with health class or whatever it's called now. It's not, I don't think most places call it health class anymore, but they can use some of those resources as well. So there's a lot of ways we can get it just beyond even the medical schools in the region. So.
Jay, and everybody, I was looking at Katie's notes from the November 7th meeting. Couple of things. I see the name Sarah Cox on there, and I know that the Sarah Cox that I know, who is a PA, who's part of our PA faculty, was plugged into that meeting, and also Angela Barnett, who's on there. But the Sarah Cox I know in the PA program doesn't have an H on the end of her name, Sarah. And maybe more importantly, she's with the PA program, not the pharmacy school. So unless there are 2 Sarah Coxes that might have been in that meeting, there might be some corrections that need to be made there.
Okay.
So it would be Sarah without the H, and then Cox,
Yeah,
and then on the PA program faculty. And the other thought there is, I've spoken with Sarah Cox, the PA faculty member, and she is very interested. She's the director of didactics for the PA program, the UMKC. She's been trying to figure out where in the curriculum, this vast, complicated thing, to start to put lifestyle medicine components. And I think the place we're gonna start, without necessarily a long-term plan in place for sure, is a course that I teach in the first semester. So that'll be actually now, which is called Professions 1. And I just have the ability to just insert a topic or two or a speaker or two here and there. Not necessarily mentioned in the syllabus, not really part of the curriculum, not in the testing, just something that's really good for the students to hear. So that, as far as I know, that's our plan so far. Just, get some of it in there somewhere, and then Sarah Cox is she may be doing the presenting, or she may provide me with her recommendations on material, and I think she's going to do it because she's excited about this.
I know Geetha Kamath and I did something for the medical students over at UMKC. It was a little bit nutrition, a little bit physical activity. It was kind of a combo between the two of us, about a 2-hour lecture. So, I could easily just give that same lecture if you got space for it, or either part of that lecture, I'm sure, if you got space for it, in the PA curriculum as well. I'd be happy to help with that. Just
Wow, that's an offer. It's got my heart rate up a little bit. That because I don't know that Sarah has anything prepared, and I certainly don't. I know that I know that Stephanie Allison has a curriculum kind of set up for the med school, and maybe fully set up. But
yeah, I already come over and do a talk for the PAs on sports physicals, so you can, I don't know.
Oh, great.
That, but I probably can't volunteer Geetha without her here, but I'm sure she'd at least be interested in talking about it, or seeing if there's a way to, just give you the information and you can do the lecture. But
well,
but
that's
yeah, that would be
fantastic.
obviously up to her.
That's great. And is she? I probably should know her, but is she
UMKC? No, UMKC physician. She's one of the physicians who actually has the lifestyle medicine certification.
Oh yeah. Okay, I met her actually that day that I met that you came over for Dr. Trook's talk. That's right.
Yeah.
Okay.
Yeah, but
that's great. Well,
I probably shouldn't volunteer her, but she always seems to be very willing to help on that kind of stuff. So.
Oh, that's great.
Yeah.
Thank you.
But yeah, I did the physical activity part. She did a nutrition part. So I don't know how many hours you got open for that kind of stuff, but I'd be more than happy.
Probably 1 or 2. But sounds like it sounds like if we can make 2 work, that would be great. Another thing is I also teach another kind of linear, that's the word I'm looking for, curriculum course. Once a month, the last day of the clinical students rotation every month. And then I've got them for that Friday afternoon. That's called callback day. And they will not have had benefit of having, heard this in year 1. So we might see if that might work for you too, to come sometime for an hour or 2. That'd be on a Friday afternoon.
Okay. Yeah.
Awesome.
Probably make that work.
Thank you.
And I've got a fellow every year, so they always need to do some lectures and stuff too. So
yeah, perfect. I'll help you help them.
Okay. Sounds good. All right. Well, I know that UMKC and KU both have done some interest group work, and I don't know where either of those two spots truly stand at this point. How well they've established their meetings and stuff, and how that's going. Because I'm not in charge of either one of those, but I don't know if Katie, I don't know if you've got any updates from either school about those other than last time. Okay.
I do
Um,
not.
And then Joey's not here, so I don't know how his project is going, but I don't know if you've heard anything about that one either.
No, I was still waiting for an update. I'll probably email him after this meeting and check again. Last I knew, they were going to start it in January, start implementing the curriculum, so, or testing it
Cool.
out.
Right. And he did get the funding from the group for that, right?
Mhm.
Okay,
He
good.
did.
And then we've got our new, because it's the new year, we got a whole new block of money, the 6,000. So if you got any projects that would be good for the KCPA plan, multi-sector, but can start in healthcare, and then we can pass that on and see if we can get anybody some extra money for that kind of stuff.
I just came before this meeting from the what's now called the the Tom Lovell Community Center, which is Legacy Park Community Center in Lee Summit. And as you guys know, pickleball has exploded, across the nation, et cetera, and certainly including Kansas City and Lee Summit. But so I don't know. That's about all I know. I've only played once, and I think it's great. I don't know if my back can handle it because I can't seem to not jump and lunge and twist and do all those things at the same time like I used to when I played tennis. So, but people love that, and I think anything we can do to contribute to expanding that and making it more accessible. I don't know how accessible it is, for the usual
Well, I
folks
think
that
it's
don't
right
get to
for
tap into some of these things.
think it's right for a KCPA plan fundraiser, though, for sure. Get a little
Oh
tournament
yeah,
party project
oh
going
yeah,
on there.
yeah.
Yeah, it's people love it. I read something. Kansas City is the most pickleball obsessed city in the country. So
Well, we ought to be able to cash in on that somehow, huh?
yeah, for sure. Sure. Right. Well, Katie, do you have anything else to add?
Our next meeting, that one, that's really it. Just as a reminder, we meet as a healthcare sector every other month. We're switching between curriculum and healthcare group. So our next meeting for the healthcare sector is March 5th, and I have a link for registration. Also, for those who are interested in pickleball, we are working to secure guest speaker for our Parks and Rec sector. She's actually she works for Johnston County Parks and Rec, and she runs their pickleball programming. Her name is Mallory Ozier. I hope I said that right. And that meeting is actually January 24th. So if you're interested in pickleball and want to know how to bring it to your organization, which obviously doesn't really apply for us, but yeah, it is very popular is what I'm saying, that we're even focusing on it in other sector groups.
That's great. And people just have so much fun, I mean,
Yeah.
they're just smiling and laughing, and most of the ones I'm seeing are probably over 60.
I mean, it's ping pong with
So,
running or mild tennis. I don't know. I don't know which way you want to call
Yeah,
Either way, it
it's
gets people
easier on the
moving.
knees. Yeah. Okay.
it. Well, thank you for coming, and we'll let you get some time back in your hour. And we'll see everybody again in March, but the healthcare sector meeting will be next month, and Just Walk will be next week.
So yeah, next walk is next week. It is January 9th, and then we have the curriculum meeting next month, which is February, I have it on here, 6th. And then we won't meet again for the healthcare sector until March.
Yeah. So we're gonna
So,
flip-flop curriculum and healthcare sector. And then
Yep.
billing, I think, is on hold still, and then the Just Walk,
Mhm.
we'll see what goes on after this next meeting.
yeah,
Perfect.
Sounds good. Thanks, you guys. That was very informative.
Right.
thank you.
Thank you. Happy
Have
New
a
Year.
great day. Happy New Year.
Happy New Year. Yeah. See you soon.